Maybe that's up to you then. I keep them on.
Ready.
I just got a notification that it's being live streamed, so it may have
Okay.
started.
Perfect.
Okay, we got
And then,
something to add.
think, yeah, that's how to stop it.
Okay,
Whatever.
perfect. Okay, thank you. Sean McDonald, Decker.
It's getting it in there where the files can.
Is that? in my- Okay. Okay, April, we're good. Thank you.
Okay, you're welcome. Do you want me to start over? Did the folks that were online not hear?
Maybe. Yeah, maybe,
Okay.
because we just entered a few more in, so.
Okay. So thank you guys for coming today. My name is April Hackey. I work for Gibson. So we are the company that works closely with the county on an annual basis to review all your benefits, negotiate with the TPAs, and
Okay, I got it out.
make sure that you have the best benefits and the best costs available. So what we're going to do today is go over what open enrollment is, what it means to you, what you need to do, and then any benefit changes that are taking place for July 1st, and then a refresher of all of the benefits that you guys have. So I would ask a couple of things. The first one is if you have questions that are specific to a health condition or a personal type of situation, I would ask that you hold those. I'm going to be available for a couple hours after this meeting, and I'm happy to, answer one-on-one questions rather than sharing those personal health situations with the entire group. And then secondly, as we move along, I'll pause and ask for any questions. So if you could kind of hold those until we do that, that would be great. If you do have specific questions as well, you're welcome to enter them into the chat, any folks that are online. Again, not anything specific to, I've got this heart condition and I want to know what the coverage is, unless you want to share that with the entire group. So open enrollment is open right now through June 21st at midnight. And what open enrollment is the only time per year that you have an opportunity to make changes to your benefits. So anything that you elect is going to be in effect from July 1st through the upcoming June 30th. The only time that you will be able to make a change outside of open enrollment is if you have a qualified change of status. And we'll talk about that, what that means to you, what that is in a minute. But right now is the time that you can go in, change plans, add a new plan, add dependents, drop dependents, update your personal information, update any beneficiaries, make sure that that's all up to date. Now's the time to do that. If you do need to make one of those changes, you're going to need to go into Employee Navigator. Everybody should have gotten an email letting you know that open enrollment is open, and it has a link in that email that you can get into open enrollment in Employee Navigator, review the benefits that you have, and complete that process. If you are not making any changes at all, then you don't need to go into Employee Navigator. You don't need to do anything. But again, if you are going to make one of those changes, or you just want to log in and get a reminder of what you've got now, that system will be open through midnight on the 21st. At that point, it will close down and you're going to be locked out. So again, make sure that those changes, elections are all completed no later than June 21st. Again, this is everything we just went through. So qualified change of status. I mentioned this. If you, during the course of the year, you have a qualified change of status, this is going to be something like marriage, divorce, you get legally separated, you have a baby, you have a child that maybe ages out, they turn 26, you have a spouse that passes away, or you have a spouse that maybe gains access to their only to their own coverage through an employer. Any of these things are going to open up an opportunity that is considered a qualified change of status. And what that means is you have the ability to make a change to your benefit elections. In that situation, you have to get with Jody with HR within 30 days of the event to make that change. And that's an IRS rule. So it's not something that, Jody can make an exception for. So if you have a baby on May 1st, you have until the end of May at the latest to get with Jody and have that child added onto the plan. So the sooner the better, but again, no later than 30 days. So what's changing? You guys have very, very minimal changes this year. So Quantum, which is the kind of care navigation that you guys have in place now, is going to be replaced with HealthJoy. That change is actually taking place on 8/1 versus 7/1, but we're going to talk about it today. You've got some slight changes to contributions as well. And then I don't have it listed here, but there are a couple changes on the HSA. The IRS reviews those amounts annually. They increase the amount that you can put into your account. And then there's a slight change to the way that the county is giving you the money this year as well, which is a huge positive. So going over just a refresher of all the benefits that you guys have a really nice and very comprehensive benefits plan here at the county. And I think sometimes it's easy to forget about the benefits that you have. So I just want to really take a couple minutes and walk through what all of those benefits are. And as a reminder, anyone that's enrolled in the medical coverage does have free non-emergency care for anyone that's enrolled in your plan. 24 hours a day, 7 days a week, 365 days a year. And that is through Teladoc. I'm going to ask anyone if they could mute themselves, please. So with Teladoc,
Michael Woodall, the estimator for driving under.
Jody, do you have the ability to mute? Thank you. So with Teladoc, again, you can do that via phone. You can do it via video chat. Anyone that doesn't already have the Teladoc downloaded onto their phone, there's an app. I would strongly suggest that you do that. The first time that you use it, you are going to need to put in your medical information, just like if you were going to the doctor's office on an annual basis, they have you put in your information. And the reason that I suggest you do that on the front side is if you do call and you have a video appointment or a telephone appointment, then that information is already in there and they don't have to ask you. Super, super convenient. We have this at Gibson and I use it all the time. I have a son who gets ear infections multiple times per year. It's really nice for me to be able to call in and have that appointment versus having to drag him out, go to sit in a doctor's office, expose him to more germs, have him have to, just be really uncomfortable, me have to miss work. So again, really nice, very, very convenient and free to you guys. So very nice benefit. On this screen, we're going to do a very high level comparison of the 3 plans that you have available to you. Again, this is a high level comparison. There is a summary plan description that Jody can send out to all of you that has much more details. You also have a SBC, Summary of Benefits and Coverage, which is kind of like the middle version. So this is really high level. You've got a benefit guide that also has a high level summary. You've got the SPD, which has, I think it's 120 pages, has everything you want to know about your medical plans. And then you've got that SBC that's kind of middle of the road. What we show on this screen is the enhanced benefit that you have available through Mackenzie, the in-network benefit coverages that you have if you go to a Cofinity provider, and then you do also have out-of-network coverage. I've not listed that here on the screen, but for anyone that chooses to go to a provider that's not Mackenzie or Cofinity, know that your deductibles are going to be double. Your coinsurance and out-of-pocket maximums are double, and anything that you see on the screen here that has a copay listed would actually be deductible and coinsurance. So again, you have the ability to go to a physician or a specialist that doesn't participate. However, there is a higher cost associated with that. So it's always in your best interest. You're going to get the most from your benefit dollars by going to either a McKenzie provider or just staying in network with Incofinity. So what we've got, again, we've got the 250 plan here on the left. We've got your 2000 plan in the middle, and then we've got your HSA qualified 3300 plan on the right-hand side. On the first line, you're going to see your deductibles. So I'm going to start by looking at the in-network column here. We're going to skip past McKenzie for a quick second. So if you go on either the POS 250 or 2000 plans, these are going to act as what you would consider a traditional plan. So when you go to the doctor, you're going to have a copay. When you go to urgent care or the specialist, you're going to have a copay. Now, if you go to have a medical procedure, for example, you're going to have your deductible that you have to satisfy, which is listed here on the top line, and then your coinsurance. So deductible, again, just like think of it as an auto policy. If something happens, you pay your deductible and then the plan starts paying. That's the same thing with a medical plan. So you're going to see one number and then a second number after the hash. So if you are enrolled in single coverage in the 250 plan, for example, you have a $250 deductible. If you have family coverage, that amount is $500. And then you see the same thing with the POS 2000. It's a 2000 single, 4000 family. After you've met that, then the plan's going to pay 80%. You're going to pay 20%. You have a coinsurance maximum on these two plans. So what that means is, let's say you have an inpatient hospitalization. You meet your $250 deductible. We're going to use the example again that you have the 250 plan. Then you're going to start to pay 20% of the additional amount. So let's say that surgery costs $200,000. If you meet $500 in your 20%, then you're not going to pay any more coinsurance. The plan's going to pick up the rest. Now you have an out-of-pocket maximum as well. And think of this as a safety net. Most people are not going to ever meet this out-of-pocket maximum. This is here to protect you in the event that you have a catastrophic medical year. So let's say in the course of 1 year, a doctor says that they think you could have, cancer, for example, and they send you for 3 different MRIs, and they send you for CAT scans, and they send you for a PET scan. And then there's an inpatient hospitalization that costs $300,000. There's a high cost surgery. There's chemo. All of that can add up, and it can add up fast. And if you don't have an out-of-pocket maximum, it could potentially bankrupt you. So what this says is, over the course of the plan year, which for you guys is 7/1 to 6/30, if you meet for a single on that 250 plan, if you meet $7,350 out of pocket, and that's going to be made up of what you pay in deductible, coinsurance, copays, and prescription drug copays. If in all those dollar amounts you meet $7,350, you're not going to pay anything else for the rest of the year. The plan's going to start picking up 100% of everything for the remaining plan year. And again, that is in place to make sure that nobody is bankrupted from this. So again, most people aren't going to meet that. That's your safety net. That's the way that I think about that. Following along on that 250 plan, if you are just going to your regular doctor's office, it's a $30 copay. Specialist visits, $45 copay. This is things like your cardiologist or a podiatrist. Urgent care, you have a $60 copay. And then your emergency room, got excited there. Emergency room, you can see you've got the $250 copay. You've got the same provisions listed here under the 2000 plan. And you can see you've actually got the same out-of-pocket maximum as well. We're going to hold off and talk about the HSA plan in just a minute because it operates differently. Now, when you look at the enhanced McKenzie benefits, so this is a nice provision that was put in for you guys on January 1st. And if you utilize a McKenzie provider, you have significantly reduced out-of-pocket costs. So again, focusing on that 250 plan, if you go and you have services provided at McKenzie, instead of having the 250 single or 500 family deductible, you have no deductible. If you go and see a primary care physician there, no cost. Same thing for a specialist, same thing for urgent care. So again, you're being incentivized to utilize a McKenzie provider. And when you do, it's going to save the plan money because McKenzie providers have agreed to accept a lower amount as payment in full. So it's saving the plan money, it's saving the county money, which in turn saves you guys money two ways. One, you have less out of pocket in either your copays or your deductible, but also because what happens every year? I stand in front of you with Nathan and Jody and say, this is what you're going to pay out of your paycheck in order to have the coverage. And obviously, if the plan saves money, we're able to come to you guys and say, great news, you're going to pay less out of your paycheck. So again, this is a win-win for everybody. When we look at the 2000 plan, your deductibles are cut in half if you're utilizing a McKenzie provider. And again, no copays for your primary care specialist or urgent care. Now we're going to talk about the HSA 3300 plan for a minute. So an HSA plan or high deductible health plan is a plan that is set up to allow you to set aside money into a tax-free account to use for qualified medical and prescription expenses going forward. So in order to do that, to have that HSA account, which is that tax sheltered account, you have to follow certain rules that are defined by the IRS. And so what the IRS says is in order to put money into an HSA, you have to require an employee to meet a deductible before anything is paid. So under this plan, if I take the POS HSA 3300 plan, I'm going to be responsible for all of my medical expenses as well as my prescription expenses until I've met my deductible. Now, if I've got single coverage, that amount is 3,300. If I'm enrolled in family coverage, that amount is 6,600. And that full 6,600 would have to be met before the plan would pay anything. Once I've met my deductible, I'm not going to pay anything as far as coinsurance goes. So where you see here deductible and coinsurance, it's actually you're just meeting this deductible. Now you will have some copays when you go to the pharmacy after you've met your deductible, up until the point that you have met your out-of-pocket maximum. And we'll talk about prescriptions in a couple minutes. A couple of notable things when you're looking at this, the POS HSA 3300 plan, I'm just going to call it the 3300 plan for simplicity. When you go to your doctor's office, I said that you're going to pay the full amount of that cost until you've met the deductible. A couple notable things about that, and this is going to be true whether it is a regular doctor, whether it's a hospital visit, whether it's emergency room, specialist, urgent care. At any of those spots when you're going in for care, you should not be asked to pay when you have that plan anything. The doctor or hospital, whatever it is, should be billing Meritain. And then Meritain is going to process the claim and then you're going to get a bill. And the reasoning for that is even though you're responsible for the cost of those claims, there's still a discount that's being applied to it. So any provider that says, yes, I'm going to participate in the Cofinity network, which is the network that Meritain utilizes for your plan, has agreed to accept a lower amount. So let's say a service normally costs $200. That provider that's participating with Cofinity may say, I'm going to accept 150 as payment in full. So they're going to send that bill in. Meritain is going to adjust it. They're going to apply the discount. You're going to get an explanation of benefits, which is what Meritain is going to send you. That's going to show you this is the amount your doctor billed, this is the discount that was applied, and this is what you owe. And then you'll get a bill from the doctor. Under all three plans, something that is very important to note is that if you are utilizing either a McKenzie or a Cofinity provider for preventive care, it's covered at 100% with no deductible, always. So these are going to be your well child, your well woman, your well male, your PSAs, your age appropriate mammograms, your age appropriate colonoscopies, your annual visits. All of that is going to be covered 100%. You don't need to pay a deductible. You don't need to pay anything as long as it's truly preventive care. So keep that in mind. Sometimes, you know, a doctor's office will mess up and they'll bill you for it. So if you do go in for, you know, an annual physical, or you take your child in and you get a bill and you're like, oh, it was preventive, and I remember April saying I shouldn't be paying this, then call Meritain and ask the question, or call HealthJoy, which we'll talk about in a minute, or stop in and see Jody and they'll help get that taken care of for you. On the HSA, the POS HSA 3300 plan, again, if you are utilizing a McKenzie provider, you're going to have a $1,600 single deductible, $3,200 for family. So again, it's lowered. And again, it doesn't, there's no co-insurance because this plan is 100% coverage after you've met the deductible. Before we jump into prescriptions, does anyone have questions on what we've covered so far? All right, we're going to move along then. So you have 3 tiers of prescriptions. Again, nothing is changing on this. This is just a refresher. So if you go to the pharmacy and you're getting your regular generic prescription and you've got either the $250 or the $2,000 plan, you've got a $15 copay. Preferred brands are going to be $30, and then non-preferred brands or tier 3 are going to be $60 copay. Again, if you have that 3300 plan, because it does have the ability to be tied to an HSA, you need to meet the deductible first. After you meet the deductible, then you would have those copays, either $15 for generic or $50 for brands. Now, this is the one thing that's different. So on the previous screen, I mentioned if you have the 3300 plan and you go to the doctor, hospital, specialist, they shouldn't be asking you for payment then. That's not true with prescriptions. So prescriptions, you do not get a discount based on a network. So there isn't a need for it to be billed. So you are going to be asked to pay for the cost of that prescription right then and there. I would highly suggest to anyone that is taking the 3300 plan to jump online and do a quick search for the medication that you're taking. The reasoning for this is that costs between pharmacies vary drastically, and it has to do with the negotiated contracts that different pharmacies have with different drug manufacturers. I will use myself as a real life example. I've done this for 22 years. I should know probably better than anybody that I should be checking the costs of my medications. I haven't. I'm on a high deductible health plan, so I pay the full cost of my medications until I've met the deductible. I have one medication that I take that is around $275 a month. I have just always gone to the same pharmacy out of convenience, out of habit, laziness, quite frankly. There's another pharmacy directly across the street. Literally, I can pull from one driveway to the other. I went on finally and just typed in the name of my medication and compared the cost at the 2 pharmacies. Literally, by driving across the street, I was able to save almost $30 a month. So jump online. You can do it in the Meritain website, or you can go on goodrx.com and you can search for the cost of your medications. So it's not going to take you long, and truly it can save you quite a bit of money. Now, if you are taking a medication that is $350 or more per month, then you need to go through a company called Sharks. Sharks is a specialty and high cost pharmacy manager. And what they do is utilize a variety of different methods to source that medication, a lot of times at no cost. So there are three main programs that they utilize. One is called a patient assistance program, one is manufacturer's discounts, and the third are copay cards and international mail order. So a lot of times, if anyone sits and watches TV at night, you will see prescription commercials, and towards the end of it, you'll hear them say, if you can't afford the cost of your drug, AbbVie may be able to help, or Merck may be able to help, whatever the name of that manufacturer is. And that's an example of a manufacturer's discount. What Sharks does is all of the research for you. So they're going to go out and they're going to look at patient assistance programs, sometimes called PAP programs first. They're going to see if there's a way to get that medication for you at no cost. And when that happens, you don't pay anything for the medication and the county doesn't pay anything for that medication. So again, saving money on both sides. If you don't qualify for one of the PAP programs, then they're going to look for those manufacturer programs. If you don't qualify for that, then they're going to look for copay cards or they're going to look for international sourcing. A lot of times, international sourcing is about 50% of the cost. These are medications that are primarily being brought in from Canada. They have to meet the same FDA rules, regulations. So this is not someone in Mexico making the drug in their bathtub. This is the same chemically equivalent safe medication that you can get here in the States, but Canada has a lot more rules and regulations regarding pricing, so we can get it a lot cheaper. So how this works with Sharks is going to be one of two ways. If you are taking one of these medications for the first time, your doctor writes you a prescription for Humira, for example, which the last time I checked, I think was around $7,200 a month. Meritain is going to send a note over to Sharks saying, hey, April just got a fill of this prescription. You need to start doing some work on it. I'm going to have the ability to get that medication filled twice at my regular pharmacy, and then I have to go through Sharks. And the reason I get up to 2 pharmacy fills is because it can take a little bit of time for Sharks to go through that process and look for ways to get that medication for me. They're going to reach out to me and they're going to ask me for a couple of pieces of information. One, I have to sign a HIPAA form that gives them access to my information because they're going to be working on my behalf, getting, my medication, which has access to HIPAA information. They're also going to ask me for some basic details about me, my social security number. They're going to ask for whether I'm married or not. They're going to ask for my income. Those are things that you have to give. And the reason for that is that first program I mentioned, the patient assistance program, is income driven. So when they're looking as to whether or not I qualify, one of the things they look at is income. That threshold is a lot higher than what you would think it would be. So a lot of times people will qualify under that. It's probably about 85% of the time. If you get a phone call from Sharks, you have to engage them. After those 2 fills, if I choose to not utilize Sharks, I don't have coverage for that medication. And as I mentioned, the prescription that I gave as an example, that medication is about $7,200 a month. So you want to make sure you're engaging with them. They will try and reach you via phone. They will try and reach you via mail. They will try and reach you via email. The quicker you start that process, the better. The second way you can get this moving is if you go to the pharmacy or you go to your doctor, he writes out this prescription for you. You don't have to wait. You can call Sharks right away. If I know this medication is going to cost me more than $350, I can call them and give them my information and get it started quicker. While you're getting those up to two grace fills, you're going to have these copays that are set here. 20% copay up to $100 maximum for tier 4, 20% to $200 for tier 5. These are your non-preferred specialty medications. So again, get that process started. Again, a lot of times these medications won't cost you or the company anything if you utilize Sharks. This is a little bit more information, and everyone's going to have access to this presentation after, but this basically is reiterating what I just went over as far as the 3 advocacy programs that Sharks utilizes, giving you a little more information on that. Again, you've got telemed available 24/7 for non-emergent conditions. So if you're having a heart attack, please don't call telemed and ask if they can help you. But if it's a situation like an ear infection or a rash, or my child has a sore throat, things of that nature, teledoc is a great way to save yourself money and make it a whole lot more convenient. You've also got what's considered a concierge app. Again, this is available starting August 1st, and this is HealthJoy. So HealthJoy is going to be a really nice thing that's going to assist you with a lot of different pieces relative to your medical plan. So HealthJoy is an app. Again, you're going to download it onto your phone, and if you go into your benefit guide, there's actually a QR code that you can click on, and you can download that app. There's a couple actually, it's not a QR code. It looks like the little app store or the Apple App Store or Google Play little triangle. You can click on those right within the benefit guide and download that right to your smartphone. If you don't have a smartphone, you can actually call or email HealthJoy to get the same services. They can help you find care. So if you're not sure, you need to get a new doctor, you can't find one, you can call them, or you can use the chatbot and they will find that for you. You can get answers to benefit questions. We, again, have this here at Gibson. I should know everything about my personal medical plan, but I can't tell you how many times I've texted them and said, what have I satisfied regarding my deductible? Rather than me having to log into the medical TPA site, I can text them, they text me right back and let me know where I'm at. If I have a question about something that's covered, hey, I've heard a lot of talk about these GLP weight loss medications. Is that covered on my plan? I can text them and they will tell me. So any kind of question regarding your medical or prescription benefits, you have access to them to help answer those questions for you. The example that I gave about pharmacies and comparing the costs. If I don't want to go online and look for that myself, I can text them. I can say, hey, I'm taking this medication. Here's my dosage. This is how much I take per day. And they can actually go in and do that search for me. You have ability to ask general medical questions. And then a big one that I always like to stress is they can do medical bill review. So I have a client right now with an employee specifically who got a bill that was about $9,000 more than what it should have been. He contacted them, said, hey, I've got this bill that looks weird to me. I don't want to have to go back and forth between my doctor and my health plan. Can you help me? They had him take a picture of the bill and send it to him. They did all of the research on the backside and actually found out that it was billed in error. His bill should have been 200 and some odd dollars. They did all of that for him. So this is free to you. There's no cost whatsoever, and you can use it 24 hours a day. So really, really great resource. Again, it's going to be available starting August 1st, and we'll send out more information. But as soon as that becomes active, again, I would suggest everybody downloads that on their phone. For complex care and second opinions. So if you are having one of these situations that are listed on here, you need to have a spinal surgery, orthopedic, cancer, heart, transplant, or bariatric, any of these surgeries. These are all things that are life-changing. Let's use cancer as an example. You get a cancer diagnosis, your world turns upside down. Edison Healthcare is the plan that we've got in place to help offer the best, fastest, and most cost-efficient care available. Edison utilizes the best centers in America. These are going to be things like Mayo Clinic, Cleveland Clinic. I'm sure you've heard about, you've heard both of these mentioned. There's, I believe, 12 within the United States. And what they will do is say, okay, you've got this particular cancer diagnosis. You're going to need to have this surgery. We want you to get to Cleveland Clinic, for example. This is the best in the country for the type of surgery that you need to have. Edison Healthcare is going to pay for all of your travel for you and a companion. They're going to pay for airfare if it's necessary. They're going to pay for a rental car. They're going to pay for a hotel stay. And this is white glove treatment from start to finish. So it is escalated, meaning, anyone that has known someone that's had a cancer diagnosis, that individual can spend months going through testing and MRIs and PET scans before they ever get to a point where they're ever thinking about having the surgery. And during that time, you've got an individual that's worrying that their life could be ended. That's an extreme example, but it's true. In this situation, those months-long wait can be scaled down to weeks. And again, you're going to the best place in the United States. If you have either the 250 or the 2000 plan, there is no cost to you for this care. So you are not only getting the best care possible at the quickest, escalated service, you're also getting it for free. If you are enrolled in that 3300 plan, because again, the IRS says you can't have any care without meeting your deductible, the minimum deductible has to be met first. So $1,650 if you are on single coverage, or the 3,300 if you are enrolled in family. You also have the ability to have second opinions. So if you have, a doctor that says maybe you need a surgery that's not listed on here, but it's still a pretty significant surgery. So it's not going to qualify to go through the Edison Healthcare program. You can still get a free second opinion by some of the best physicians in the United States. It's an independent board, so it's not tied to your medical plan. They're not getting incentivized to either send you or not send you for surgery. And it really is a nice way. I'm going to pick on spinal surgeries, and the second opinions apply to these as well. Spinal surgeries, the last number I read was that about 45% of spinal surgeries are misdiagnosed. If you know anyone that's had a spinal surgery, they're extremely painful. There's a very long recovery time, and a lot of times people have serious complications that arise down the road. I have an ex-sister-in-law who had 3 spinal surgeries because she continued to have issues with additional vertebrae a couple years down the road. So again, the second opinion piece, critical. The complex care for any of those 5 surgeries, life-changing and no cost to you with the free care and travel. This is an extremely reduced cost schedule for the county as well, because there are direct contracts and negotiated rates. So that's why they are able to offer this to you. This is voluntary. So if you are having a cancer treatment, you need the surgery, and you say, I would rather go to my doctor that's local, you can. You don't have to utilize the Edison plan. But again, it's here for anybody that is enrolled in the medical plan. And I would strongly encourage anybody that hits one of those diagnoses to take advantage of this, because it really is, it's top notch. You also have another plan that is available to you, and this is called the Samaritan Plan. So anyone that's enrolled in the medical plan has access to the Samaritan Fund. What the Samaritan Fund is literally a fund. So it is a nonprofit charity organization that deals with comprehensive donors who have basically a soft spot for particular conditions. An example would be, I have a client who has a muscular dystrophy, an employee with MD. And so that is a ongoing, very expensive, very complex condition that is going to need continuous care, and it's going to cost a lot to their employer. It's going to cost a lot to them. They have the ability to call Samaritan Fund and say, hey, I think I may qualify for your program. Samaritan Fund is going to look to see if there are any donors that are willing to pay for that program. And if they are, they're going to say, hey, Jane Doe, you qualify for this. We're going to move you off of the Sanilac County plan for this year, and we're going to pay for a medical plan for you that utilizes all of the doctors that you're using now, and we're going to pay for all of it. The fund is going to cover the cost of that plan. They're going to cover the cost of all your prescriptions. They're going to cover the cost of everything for you. So you are getting free coverage for 1 year. That's for you and any dependents that you currently have covered on your plan. Not every single person is going to qualify for this because, again, this is something that is set up for complex, ongoing, very high cost conditions. So if you are someone that is watching this, that's logged in right now, or that's in the room and hearing me talk, and you think you have a condition that could potentially qualify, and again, this is anything, this could be a child with a heart condition, for example, that's going to be ongoing, and you know this is going to cost a lot of money, and it's a serious condition. There is nothing, there's no hurt in calling and asking whether or not you may qualify. The worst thing they can say is no. There's a chance they could say yes. So take advantage of this if you think there's a chance you could qualify. We're going to go into health savings accounts a little bit. So again, if you enroll in that 3,300 plan, I mentioned this is a high deductible health plan. We all know now that we have to meet everything with the exception of your preventive care before the plan starts to pay. And if you do that, you're going to be enrolled in a health savings account, or sometimes referred to as an HSA. An HSA is a personal tax sheltered account. You own this. The county does not own this. This is a bank account that you own. And money that goes into this account is done so on a pre-tax basis. You can then use that money on qualified out-of-pocket health care, medical, prescription, dental, and vision expenses for yourself and any tax dependents. That tax dependent part is important because you can cover your dependents, whether they are tax dependents or not, up until age 26. But the IRS says you can only use an HSA for someone that is a tax dependent. So for most situations, that's going to be a child up until age 19. Myself as an example, I have a daughter who is a full-time college student. I am paying for everything for her. I still claim her on my taxes, and therefore I can use my HSA to reimburse her expenses as well. Now, if she drops out of school, I can no longer claim her on my taxes, and therefore I couldn't use my HSA for her expenses. Again, the money goes into my account tax-free, and I can use it tax-free for qualified expenses, or I can let that money sit in my account and grow year over year tax-free. There's no use it or lose it requirement. I can do what I want with it. I'm going to be enrolled and get a debit card. And again, if I choose to leave the county, I retire, whatever the situation is, that money goes with me. Also, another thing, you want to make sure that you are being cognizant when you're using this money. Jody, Nathan, no one is going to stand over your shoulder and say, hey, April, is that really a qualified medical, dental, or vision expense? So if I go to Walgreens and I'm picking up a prescription and I'm going to use my HSA to pay for it, and I also grab a couple bags of chips, no one's going to say you can't use that account to pay for those chips. However, if I use that account to pay for non-qualified expenses, then I am subject to a 20% penalty as well as income tax on it. So you really, again, to get the most out of this, you want to make sure you're using it for qualified expenses. Those are things like your deductible, your coinsurance, any cost of your prescriptions. If I'm going and I have dental coverage, the amount that my dental plan doesn't pay. If I'm getting 2 pairs of prescription glasses, but my plan only covers one, I can use it to pay for the other one. When I participate in that account, again, there are a couple of rules that need to be followed. So I have to be enrolled in a qualified HDHP, high deductible health plan. Again, the 3,300 plan here qualifies. I cannot also be enrolled in first dollar coverage. First dollar coverage is what you would consider to be a traditional plan. So the 250, the 2,000 that we showed here, any plan that does not require you to meet the deductible before it pays anything is going to be first dollar coverage. So I can't be enrolled in my spouse's PPO plan where I have a $30 copay when I go to the doctor and also be putting money into my HSA. I'm going to get dinged by the IRS. Flexible spending accounts count as first dollar coverage. Medicare, TRICARE, VA benefits, Medicaid, all of those are things that are going to make me disqualified to put money into my HSA account. I also can't be claimed on another person's tax return. So if we've got any individuals on the line that are on their parents' plan, and they're being claimed on their taxes, you're not going to be eligible to participate in the HSA. There's a link in both this presentation as well as in the benefit guide that you can get to on the IRS website that's going to show you a long list of everything that is qualified. When you enroll in the 3,300 plan, to get you started, the county is going to open an HSA account for you. You're going to get a link, and they're going to put money into that account for you. So you're going to get $600 if you enroll in single coverage, $1,200 if you enroll in family. That money is going to go into your account on your first payroll in July. If you are a new hire that's listening to this after 7/1, that amount is prorated based on your hire date. The IRS sets some rules on an annual basis to say how much you can put into your account based on what coverage level you have. So if you enroll in single coverage, you can put up to $4,150 into your HSA. That amount includes what the county is putting in. So you can't go over that $4,150 combined with what the county is giving you and what you're putting in. Now, if you are 55 or older, you have the ability to put up to an additional $1,000 into that account if you choose to do so. I'm going to pause there for a minute. I know we've only got about 8 minutes left, but the rest of the information is probably not as meaty as what we've covered regarding the medical and all of the aspects and the HSA. Does anyone have questions on anything regarding the medical plan or the HSA? Quiet group. Okay, I'm going to go through the rest pretty quickly. Again, no changes to any of this. You do have the dental plan that's offered through Delta Dental. You have 100% coverage for your diagnostic and preventive. These are going to be your checkups and your x-rays. You've got 75% coverage for class 2, 50% for class 3. And then if you do have kids that are enrolled, they have orthodontia coverage up to age 19. It is a 50% benefit. You have an annual benefit maximum for class 1, 2, and 3 that is $1,000 per member per year. And then you have a lifetime maximum for orthodontia, which is $1,000 as well. There's no deductible and there's no waiting period for specific services. You have vision benefits available to you through VSP. Under this plan, you can get an eye exam annually for a $10 copay. You can get new glasses, lenses, and frames with a $10 copay once per year. Your lenses are included in your prescription glasses copay. It's your basic lenses. Now, if you choose to get lens enhancements, there's a detailed summary of what the different copays are. So if I choose to get transitions or something like that, or the specific tint, I can do that, but there's going to be another copay associated. With frames, I have an allowance. So this is included in my $10 copay up to $130. If I go over the $130 allowance, then I have a 20% discount. You do have the ability to choose to get contacts in lieu of glasses. And again, you've got a $130 allowance on that as well. There's a hearing aid discount that is applied if you elect that VSP plan. So if you do take VSP, you have this discount plan that's available to you. It's through True Hearing, and it does offer discounts on brand name hearing aids, batteries. You get a free trial period. So anyone that is looking for a hearing aid that takes the VSP plan, this is a nice enhancement. Everyone that is a full-time employee here at the county does get basic life and AD&D coverage provided by the county at no cost to you. I'm not going to go through everything, but basically police officers get $20,000, all other employees $10,000, and then you have an equal accidental death and dismemberment benefit. Basically, this is a benefit no one ever wants to talk about, but let's say you're a non-police officer enrolled in this plan, you pass away due to normal causes. I'm sorry, guys, I can't speak today. Your beneficiary would get $10,000. You pass away due to a car accident, they would get $20,000 because they've got the $10,000 plus they've got the accidental death. Please make sure your beneficiaries are up to date. If something happens to you, they have to pay based on who's on your beneficiary form. So if you've gotten divorced and remarried, please make sure that that's up to date or whatever type of situation you're in. If that $10,000 or $20,000 is not enough for you, you have the ability to elect voluntary life insurance also through Mutual of Omaha. You can elect coverage for yourself on $10,000 increments, up to $300,000 or 5 times your annual salary, whichever is less. And you have a $100,000 guarantee issue. So what that means is, as a new hire, you have the ability to elect up to $100,000 without answering health questions, which we refer to as evidence of insurability or EOI. If anyone here is not a new hire and they waived voluntary term life initially and now they want to elect, you can, but you're going to have to complete that evidence of insurability form, which is basically answer some health questions. Mutual of Omaha will review that and then approve or deny you. When you elect coverage on yourself, you have the ability to cover your spouse or your dependent kids. And amounts are in $5,000 or $2,000 for spouse and children. And then you can see the maximum benefits here. You have the ability to elect optional benefits as well. These are all through Mutual of Omaha. You've got the option to take voluntary short-term disability. This pays you if you're temporarily disabled and unable to work. 60% of your weekly earnings up to $500, up to 13 weeks. Guarantee issue, again, is available during your initial new hire eligibility period. And anything after that, you would have to answer those health questions and get approved. And this does have a 3-6 pre-X. What that means is if I am enrolling for the first time, if during the 3 months prior to my effective date, I was treated for a service, I am not going to have coverage for that particular condition for 6 months. Good example of this, I'm pregnant and I'm taking coverage 7-1 and I'm going to be giving birth 2 months after my coverage kicks in. That benefit is not going to be available to me for that pregnancy because I was already pregnant during that 3 months prior. Anything else, someone, I'm not going to use myself because I always feel like I'm cursing myself. So if an employee has a heart attack after they've been on the plan for 2 months, but they didn't have any treatment for a heart condition prior, then that would be covered, but that pregnancy wouldn't. You can take critical illness or accident. Critical illness is going to cover, just like it says, a critical illness. You are diagnosed with a heart condition, you have a stroke, anything like that, there's a set benefit that would be paid for that. Voluntary accident, this is what a lot of people think of as AFLAC type coverage. So you have a child, you enroll, they break an arm, you go into the hospital, there's a benefit that's payable for the hospital admission. There's a benefit that's payable for the cast. There's a benefit that's payable for the x-ray. There's more information on all of these plans available in your benefit guide, and then full benefit summaries available in Employee Navigator. An important benefit that you have that is free to any full-time employees here, covered by the county, again, at no cost to you, for you and anyone that lives in your household, is going to be an EAP, Employee Assistance. This is available 24 hours a day, 7 days a week, 100% confidential. Nothing is reported back to Jody, Nathan, or anyone at the county. And they can help you with things like family and relationship issues, emotional well-being, anxiety, grief, financial wellness. If you have someone that's going through addiction issues, or if you yourself are dealing with it, stress, things also such as elder care. If you need to put a parent into a long-term care situation, it can be extremely frustrating. You can spend tons of hours doing this. You can actually call them, give them the specs of what you're looking for. They'll do the work for you, call you back with a list of places that meet what you're looking for as far as budget, distance, nurse, caregiver to patient, provider number, all of that type of stuff. So the Employee Assistance Program is extremely valuable. Please, everybody take advantage of it. The phone number is listed in your benefit guide, and there's also information with an Employee Navigator. Hang with me, guys. I know we're right at noon. We're almost done. Again, you've got a lot of resources available. HealthJoy, which is rolling out 8.1, is going to be there to offer medical and prescription support. Employee Navigator, right now you've got current enrollment information. So again, if you're not sure of what you're currently enrolled in, hop into Employee Navigator and verify it. You're going to also see all of your covered dependents, and you've got full benefit summaries for all of the benefits that you have available to you. Your benefit guide has summaries, high-level summaries of all coverages offered, direct links and phone numbers for all the different carriers, compliance information. All of that can be found within your benefit guide. And then, of course, you've got HR that's always available to support you guys. What do you need to do? We covered a whole lot of information in an hour today. Review your current elections and all the benefits that are offered to you. Make sure that you're choosing the plans and covering the people that you want to be covering. Again, benefits are going to be in effect from July 1st through next June 30th. So make sure that you choose wisely. If you have a question, ask it. We are happy to answer any questions that you may have. We want to make sure that everyone is comfortable with the benefits that they have and they're making the best choice possible. Again, if you are making changes, go into Employee Navigator and complete that process no later than the 21st. If you are increasing your voluntary life or electing for the first time and you're not a new hire, you're going to need to complete that E of I, evidence of insurability form. That also can be found within Employee Navigator, or Jody can help you get a copy of that. Get that submitted to Mutual of Omaha as soon as you can. There's a link as well that you can do it directly on their website. I would actually suggest you do it that way. It's the quickest. And again, if you're not making any changes, you don't have to do anything at all. Your benefits are going to roll forward. A very important note, whether you make a change or you don't make a change, if you are enrolled in the medical plan, you are going to get a new ID card 4/7/1. That should be arriving. It'll probably arrive the last week of this month or the first week of July. Once you get that, destroy your current card and start using the new one. The reason for the new card is because Quantum is going away. We need to remove that logo off. So anyone that has the medical plan knows there's a little Quantum logo that's listed on your current ID card. We don't need that anymore since you're not going to have Quantum. Questions? that is everything I have. If you don't have questions, anyone that did not sign in that's in person, please make sure you do so because there are going to be drawings for a couple of gift cards. And then if you are online, Jody, you have a list of everybody that's participating, right?
Yes, yes, I
Okay.
do. Yep.
Yep. So anyone that's that is participating online, you're